So in Western medicine, the body tends to be compartmentalized into the various systems, and you're often sent to different specialists. You may be sent to the cardiologist, the endocrinologist, the pain specialist. Sometimes a whole person falls on the wayside a little bit. In Eastern medicine, we look at the well-being of the whole person on the physiological, the emotional, and the spiritual level. They all tie in with each other. Our practice falls under the category of Eastern medicine. Acupuncture is one component of traditional Chinese medicine. So Western and Eastern medicine are by no way mutually exclusive. In fact, they can complement each other. Western medicine really shines in emergency situations. If you've had an accident, if you have a physiological abnormality that requires surgery, Western medicine is going to be the way to go. Eastern medicine really shines with the chronic issues, where sometimes Western medicine has nothing else to offer. Symptoms or issues like chronic fatigue, fibromyalgia, end-stage cancer patients, those would be great candidates for Eastern approach. So Lokahi signifies unity or harmony, and we chose this name because we focus on treating the entire person, body, mind, and spirit, creating harmony between all these different aspects of the person. Now, acupuncture is just one aspect of traditional Chinese medicine. As licensed acupuncturists in California, we're trained in all the 5 branches of traditional Chinese medicine. And aside from acupuncture, these include herbalism, massage, dietetics, and qigong. A lot of people choose acupuncture because, unlike with Western medicine, there are virtually no side effects. People usually walk away from our office feeling much better than they came in. Sometimes people may feel a little bit worse before they feel better, and that's just a natural part of the healing process. A lot of our patients end up in our office because they've tried everything else and they've reached the end of their rope. One of my patients is struggling with fibromyalgia, and Western medicine wasn't able to offer her any viable options. With acupuncture, she's able to get through her week with less pain and greater comfort. Our patients generally leave here feeling much better than they did when they arrived. I have one case who arrived here saying she was a bundle of nerves, and by the time she left, she said she was completely zenned out. So we love to hear that. I treat any kind of pain, whether it's acute or chronic. Some of the common symptoms that people come in with is upper back, neck, and shoulder pain, especially here in the Silicon Valley. People are always hunched over their computers and they get very tense. We can help to relieve that. We work quite a bit with low back pain, sciatic pain, knee pain, elbow or shoulder pain, a frozen shoulder, tennis elbow. The pain can stem from injuries. It can be a tendinitis, which is an inflammation of the tendons, or it can be an arthritic type of pain. There's a wide range of pain that we can address with acupuncture. My personal specialty lies in working with digestive issues, mental, emotional issues, and women's health. In terms of the digestive issues, some of the common complaints that I see are chronic constipation or diarrhea, chronic acid reflux, bloating, discomfort, weight gain. My patients may have been diagnosed with irritable bowel disease, Crohn's disease, ulcerative colitis, GERD, which is gastroesophageal reflux disease, and generally experience a great deal of discomfort with their digestive health. I treat people with depression, anxiety, or mood disorders. Oftentimes people will come to me because they either would like to avoid medication or want to taper off medication. I've worked with women who, knowing they wanted to get pregnant, had to get off of anti-anxiety or antidepressant medications, and I can assist them with that. In terms of women's health, I work with younger women who are experiencing either discomfort with their periods. They might have been diagnosed with endometriosis and have very painful cramping or heavy periods. I work with women of all ages dealing with menstrual irregularities, working on regulating the menstrual cycle and helping them go through the month with more ease, experiencing less fluctuations in their symptoms. I also work with women during menopause, helping to reduce hot flashes, night sweats, irritability, and I work with women both prenatally and postnatally, as well as during pregnancy, to help manage symptoms. We can help women who have a history of recurrent miscarriage to make sure that the pregnancy sticks. We're also working with different symptoms that come up during pregnancy. In the beginning, it's mostly fatigue and morning sickness. Some of our patients experience insomnia or increased anxiety. During the second trimester, women tend to start to feel a little bit better and need less help from us. In the third trimester, they start to have more aches and pains as their tendons are stretching out, the ligaments are stretching. We can help with low back pain, hip pain, as well as the digestive discomfort of the baby pressing on the stomach and causing acid reflux. So when you come in for your first session, you'll want to plan on being here for about an hour and 15 or an hour and a half. We'll spend a little bit more time talking. You'll have a little bit of paperwork to fill out at the beginning. In general, our treatments last about an hour, and we spend some time at the beginning of the session talking about your concerns, what may have changed since the last time we see you. We look at your tongue, we feel your pulse, we determine the treatment plan. If need be, we may incorporate some body work. At this point, we get you on the table and we begin with the treatment. And once you're resting on the table with all needles in place, you get to relax for anywhere between 30 to 40 minutes. So we have different tools that we can use as part of our acupuncture treatment. One of them is called cupping. We use these glass cups and we create a suction with a glass cup. So what we do is we hold a flame inside the cup that burns off the oxygen and then swiftly place the cup on the skin. This creates a vacuum. This is going to pull up on the skin, and I always warn my patients that this will leave a mark. It'll look like a big hickey on your skin. Depending on your skin type, it can take anywhere from a few days to a week for it to fade away. It looks like you've gotten a hug from a giant octopus. There's a couple of things that this will do. For one, this will help to increase circulation to the area to help speed up the repair of the tissue. The other thing that it does is that it acts pretty much like a reverse deep tissue massage. Now, when you have little muscle fibers sticking together, forming adhesions, this is going to put pressure on the nerves. The nerves will then send pain signals to the brain, and that's why you're experiencing pain. What we're doing with the cupping is to literally give those nerves some breathing room to regenerate by pulling the muscles apart that are pressing on the nerves. This will interrupt the pain feedback loop, and the body can heal and you can start to feel better. So another tool that we have is called a gua sha tool. We also call it scraping. Now this is a very high-tech tool, looks just like a soup spoon in the Chinese restaurant. We use this tool to get into some of the areas that might be a little bit harder to get to with the cups. So for instance, in the neck area, we might scrape the patient's neck, or we can work the area between the shoulder blade and the spine. Great way to release muscle tension there. It's pretty much like a very strong thumb from a deep tissue massage therapist. And then another tool that we use is called moxa. The moxa looks like a long cigar stick. You can see it right here. And we will light the end of the moxa. I've got my special blowtorch, which makes me look a little bit like a badass, but it helps to light it much faster. We will hold the moxa generally over some of the points that we've needled, but it doesn't have to be. We often send our patients home with a moxa stick to use at home. Great for any issues, tendinitis, tennis elbow, frozen shoulder, that sort of thing. If someone has twisted their ankle, if they can use the moxa at home on a daily basis, they will heal much faster. So that's a tool that, with proper instruction, our patients can use at home. And more insurance companies now cover acupuncture treatment. We're currently contracted with Cigna and Valley Health. However, we have a lot of patients who are with United, Anthem Blue Cross, different insurances that we're out of network with but can still bill for them. The best way to find out what your coverage is to give our receptionist a call. Have your insurance card handy. She can take down the information and verify your benefits for you so that you know how much of a portion you would be responsible for. Some of our patients have no copay. Other patients will have a minimal copay. We can find out the details for you. For additional information, you may visit our website at www.lokahiacupuncture.com or call our office and speak to our friendly receptionist, Lori. Our phone number is 408-279-9001. We'll also be happy to give you a free 10-minute phone consultation if you have any questions as to how acupuncture might help you.